Hi, this is Dr. Ray Lueck. I want to share with you, along with the wife of an individual who has come for the biofeedback due to brain injury from a motorcycle accident. Talk a little bit about how significant his brain injury was, so how severe was his accident?
He was involved in a motorcycle accident and he had 3 hematomas on the brain. And it was a very tragic injury that left him with a lot of deficits, most notably long and short-term memory and coping with his emotions. And a lot of that has been improved significantly with our work here.
And how long was he in the hospital, or how many surgeries did he have? Or...
He had several surgeries. They had to remove the blood clots on his brain, and they had to go in a second time to install a shunt to control the fluids that were accumulating in his ventricles in the brain. He spent 5 weeks in ICU in Madison and was transferred to an acute brain coma unit at Columbia St. Mary's here in Milwaukee. And he was there for 8 weeks and then transferred for 5 months to a brain injury rehab facility where he lived 24/7, and then he came home after that. And even then we had a lot of work to accomplish. Jim and I came here looking for help to assist him in his recovery from the brain injury. He had some difficulties in managing his emotions, mostly his anger. His awareness level was not very acute, and he had issues he needed to work through, and we needed help. We couldn't do it on our own. So with your help, Dr. Lueck, your biofeedback technique has been very instrumental in helping Jim with all of these areas. He's showed noticeable improvement.
And what you're looking at here is a progress report sheet that we've been filling out on, kind of a monthly basis, looking at some of the issues, and I'm showing this instead of the individuals involved, just for confidentiality reasons, but just so you can kind of see what has been going on. Treatment began with me on May 8th of this year, and so we've been working on reducing anger, which in June was still at a 3 and has moved up now to a 9. Feelings of inadequacy from a 2 to an 8. He used to get overly upset when he made a mistake or did something wrong, and that has changed significantly from a 2 to an 8. Communication skills, he used to interpret everything in a negative way, so that's gone from a 3 to a 7. Getting frustrated with himself, he used to be a kind of an IT technical person resolving conflicts, and it's been very frustrating for him to lose some of his mental capacities to fix things or to remember things, and so he used to get extremely frustrated with himself when things didn't go the way he wanted. His startle response has also gone from a 3 to a 7. I gave him some other things to work on, some affirmations and some breathing exercises, so he's doing those. And then looking at social skills, short-term memory, organizational skills, sleep, and independent functioning. So those are just some of the positive changes. If you would talk for a little bit about your marriage and what changes you've noticed as far as your marriage relationship.
Like all married couples, we had some difficulties even prior to Jim's accident, and it was just magnified after his brain injury. So we definitely needed some help. We needed some intervention, somebody to help us work through these difficult areas. And again, with your help, Dr. Lueck, we've been able to overcome a lot of obstacles. And there was a time I felt very hopeless and alone. And right now I feel like Jim and I are in a very good place. We have a happy, healthy marriage, and I think we're on a much better path.
So this was a very significant injury. So from all the treatments that you've been through, what's been different with the neurofeedback than the other treatments?
I would have to say faster results. Maybe that has a lot to do with the time that transpired, and maybe he was in a better position to respond to the neurobiofeedback, that I'm not sure, but most notably the results were coming quicker.
And as far as medication, what's happened with that?
He was on Adderall and he really couldn't function well without it. On the days that he missed his medication, you could definitely tell he just was not sharp and focused and couldn't do the task at hand without assistance. And since then, within the last month and a half, we've been able to take him off the Adderall and replace it with another product that is more natural, and we've seen wonderful results. I think he's better off not being on the Adderall.
Do you remember how much he was on, what the dosage was?
He was taking Adderall 2 times a day, 10 milligrams each time.
So even without the Adderall, he's made significant progress and is functioning much better than he used to?
Yes, very much so.
Okay. What would you say to people who are considering, or looking for help, for brain injuries?
I would ask them to give you a call, Dr. Lueck, consult with you, open their minds and open their hearts, because anything is possible.
And so this has been a good experience for you and Jim?
Yes, I would highly recommend it to anyone.
Okay, thanks so much. It's working with situations like this that make my job so rewarding. It's just a thrill for me to be able to see someone who comes in and their life is extremely dysfunctional, and then over time things begin to gradually change, and in some situations we have miraculous results. Here was a marriage that was on the verge of divorce, and now they're happy and functioning and doing wonderful with each other. The nice thing is that the neurofeedback is a one-time treatment. It's not something that people need to keep coming back for the rest of their life. So with this individual here, once he completes treatment, I don't expect to see him again. If you have any people you know of that could benefit because of some issues they've had emotionally or cognitively, please give us a call. Thanks so much.